Welcome to this independent network guidance on coronavirus and the strain known as COVID-19. COVID-19 is an illness caused by the virus coronavirus. The first case is believed to have been identified in November 2019 in Wuhan City, China. The World Health Organization has stated the virus outbreak is now a global pandemic. This means an infectious disease is passing easily from person to person in many parts of the world at the same time. The word corona means crown in Latin. It is named coronavirus because the virus resembles a crown when it is studied under a microscope. The disease infects the lungs. The symptoms are similar to a flu-like illness and, according to the NHS, develops in the 14 days after exposure. The main symptoms of COVID-19 are a high temperature, a new continuous cough, and a loss or change to the sense of smell or taste. During the early stages, symptoms can be confused with other bugs like cold and flu. People are most infectious when they have the symptoms. There have been suggestions that a person may be infectious and spread the virus before they show the signs of being sick. For more information, follow the NHS guidance. When an infected person coughs or sneezes, small droplets containing the virus go into the air. These infected droplets can be breathed in by another person, who is also likely to become infected. It spreads very much like a common cold. These tiny droplets containing the virus will land on surfaces and temporarily contaminate them. You can become infected by touching a surface that has infected droplets that have landed on it. That includes hard surfaces, clothing, or another person where droplets have landed. Spread is most likely to happen where there is close contact with an infected person. The virus is highly likely to spread if that person touches their own face after touching an infected person or surface. A question that is asked frequently is how long will the virus survive on a surface? Well, as per the government website, this depends on a number of different factors, including what surface it is on, whether it is exposed to sunlight, differences in temperature and humidity, exposure to cleaning products. Under most circumstances, the amount of infectious virus on any contaminated surface is likely to have decreased significantly by 24 hours and even more so by 48 hours. It is essential that you follow a robust infection prevention process and follow the control measures set out in your COVID-19 risk assessment in each setting. But let's take a look at what you can do. Catch coughs and sneezes with a disposable tissue. Dispose of this safely and wash your hands. In certain environments, a sneeze can travel 7 to 8 meters with some droplets hanging in the air for hours. A cough can travel as fast as 50 miles per hour and expel almost 3,000 droplets, whilst a sneeze can travel up to 100 miles per hour and create upwards of 100,000 droplets. Avoid touching your eyes, nose and mouth, even if you have washed your hands. A recent study suggests people touch their faces on average 23 times an hour, and roughly 40% of those are around the mouth. Avoid close contact in all settings and adhere to the current guidelines on social distancing. Implement more than usual cleaning regimes, including mobile phones, desktops, computers, tools, etc. To prevent the transmission of the virus, hand washing is key after all activities such as greeting people, visiting the toilet, smoking or vaping. The list is long and this one isn't exhaustive, so hand washing will vary in different environments and different scenarios. Transmission of the virus through clothing must be prevented. Freshly laundered clothing must be worn in the work environment every day. During this period of coronavirus, further hand hygiene and transmission prevention must be implemented. Washing your hands after touching surfaces and materials that other people have touched. Extra methods should be implemented, for example, before you leave home and when you arrive home, when you arrive and when you leave work, whilst at work, between tasks and breaks. No list is inclusive. This means there will be other situations and procedures in the work setting that need to be identified. The NHS is clear on the spread of germs. They ask you to catch it, bin it, kill it. During this pandemic, if you are worried about your symptoms or the symptoms of a family member, colleague or person you support, please use the NHS 111 coronavirus service online. Only call 111 if you cannot get the help you need online. If you have symptoms, you will also need to notify your employer at the earliest opportunity and follow your organisation's sickness policy. If you feel that you have the symptoms, follow the guidelines and head to the NHS Symptom Checker. This will provide the details of what to do next. The individual should use the NHS System Checker and Coronavirus 111 online webpage. If you cannot get information online, they should call NHS 111. If they are seriously ill, injured, or there is an emergency, they should call 999. They will need to explain where they have returned from and their symptoms. If the person is not able to call the NHS themselves, then someone else will need to make that call on their behalf. In all cases, follow the NHS guidance on infected people. The UK was one of the first countries outside China to have a prototype-specific laboratory test for this new disease. People showing the symptoms who call 111, who have been to one of the affected areas or have been in close contact with someone who has the virus, are now likely to be tested. All hospital patients with flu-like symptoms are also likely to be tested. The company must implement an emergency plan as set out under the Management of Health and Safety at Work Regulations 1999. This is even more prominent now during COVID-19, as we need to understand how to deal with these emergencies. If not, now is the time to get one in place and discuss how you will need to respond to this and other emergencies. Remember, the circumstances will be different for people in different roles. The general advice to reduce the transmission is: increase the frequency of cleaning the surfaces and objects around you. More hand washing. Maintain a social distance. Wear the usual PPE and wear any additional PPE as required.
You can make a difference. That's why the government asks you to stay alert, control the virus, save lives.